Wauguzi wanaofanya kazi katika sekta ya afya ya akili kutoka kote nchini wamekusanyika katika mji wa Nanyuki, kaunti ya Laikipia kwa kongamano lao la kila mwaka la kisayansi linalolenga kupunguza mzigo unaoongezeka wa matatizo ya akili. Kongamano hilo la siku 3 linafanyika wakati ambapo kuna wasiwasi wa ongezeko kwa matatizo ya kiakili, mengi yao yakibaki bila kutambuliwa. Hali hii imechangia matokeo mabaya kama vile kujiua, mauaji ya wanawake, ukatili wa kijinsia na kijamii, matumizi ya dawa za kulevya na pombe kupita kiasi, pamoja na kuvunjika kwa familia miongoni mwa changamoto zingine. Katika siku ya kwanza, washiriki hao wakiongozwa na naibu gavana wa Laikipia Ruben Kamuri walitembea mjini Nanyuki ili kuhamasisha umma kuhusu umuhimu wa kutafuta msaada wa kimatibabu mapema wanapokumbana na changamoto zinazoweza kusababisha matatizo ya afya ya akili.
And this is purely to sensitize our people on the essence of intervening on mental health issues. We are all aware that mental health problem has really become a concern of everybody, not just in Kenya but globally. However, our attention is in Kenya because that is where we are. And in this case, we all know that the prevalence of mental health conditions or diseases is 1 out of every 4 people. And that is about 25%, and therefore it is a really concern of everybody. And the other thing that has always been there is that mental health has never been given the proper attention that it needs to be given. It is quite imperative that we sensitize our people and we make them aware of mental health issues, and maybe even where they can seek attention. I think this is a good thing, and we really want to welcome everyone as we walk around. Let them know that we are purely coming out to remind them that we are all either affected or we are in one way or another taking care of somebody who is affected by mental health.
Kongamano hilo linaloongozwa na kauli mbiu kuleta pamoja ujuzi wa kitaalamu wa kisasa ili kukabiliana na shida za kiakili linafanyika chini ya mwavuli wa kitengo cha uongozi wa afya ya akili, likiwaleta pamoja wataalamu wa afya ya akili pamoja na wawakilishaji kutoka serikali za kaunti na kitaifa ili kujadili changamoto zilizopo na zinazoendelea kuwa donda sugu.
And we have very interesting topics this year. Our theme, we are looking at integrating innovations into mental health care for a resilient future. So we want to build a resilient future. Resilience here, we are talking about resilience in the healthcare system, resilience among our healthcare professionals, resilience among the community, because we know the prevalence of mental health or mental health disorders is in the increase, and therefore we need to be able to prepare as a country for our future. We can only prepare that if we are able to create resilience in the healthcare system, among our patients, among our community, among healthcare providers, because like we said, all of us are affected in one way or another. And therefore we are going to have a number of topics or research papers presented in that particular conference. We will look at the interlink between climate change and mental health. We will look at the interlink between medical diseases and mental health, because we know chronic medical diseases are risk factors to chronic mental illness.
Kongamano hilo litakalokamilika Ijumaa litashuhudia uwasilishaji wa tafiti mbalimbali zikiwemo kuhusu athari za mabadiliko ya tabia nchi kwa afya ya akili, hali ya afya ya akili miongoni mwa vijana na pamoja na hatari ya kujiua kwa wagonjwa wa saratani.
We're also going to learn about suicide. All of us agree that in the recent past we've had many incidents, many cases of our citizens, our members in the community, our brothers and sisters dying from suicide. So one of the things that we'll be talking in that conference, or papers that will be presented in that conference, is about suicide and suicide management. The risks to it, how to manage it, how to support somebody who is struggling, because we know that behind any suicide attempt, behind every person who died from suicide, there could be underlying, medical and also mental and even social issues. And we want to be able to address that so that our nurses and other healthcare providers or other conference participants who will be joining the conference can be able to be equipped to actually go back to their county and be able to offer the necessary or the optimal mental health care to their patients and even the community.
Today we are here. We came to visit, we came for a mental health conference here in Nanyuki, where all the 47 counties have gathered to share our challenges and to see how we can help each other in different counties. The expectations here is to learn and know how other people are handling the mental health issues, especially where there are disasters, and also to share them the experience we had in Kilifi County, where we had the Shakahola massacre, where people were ruined through the church, through their faith, and they happened to get mass deaths.
Nikiripotia Captain TV nikiwa Nanyuki, kaunti ya Laikipia. Jina langu ni Sibongile Mwanjala.